I think what I hope to accomplish is just awareness that my legislators and my representatives know what rare diseases are and that they exist and the importance of advocating for them and making change, and they're those people who can make those changes.
On February 29th was the recognition of Rare Disease Day. There's a series of events that are occurring from the 29th through March 3rd. They include a tour of the NIH, National Institutes of Health, learning sessions, breakout seminars, give advocacy representatives a taste of what Wednesday will hold, which is a day of meetings with legislative aides, senators, and representatives. It helps build the confidence in what lies ahead for people who have been given the opportunity to represent their advocacy organizations and their community.
We are here in Washington, D.C. advocating for rare diseases and specifically cystinosis.
I'm here in Washington, D.C. on behalf of the Cystinosis Research Network, and I'm trying to get my point across on medical coverage as an adult.
I feel that it's important to advocate for myself because I'm not only representing myself, but I'm representing other cystinosis patients as well as other rare disease patients.
Because rare disease is identified as one diagnosis in approximately 200,000 cases, it is small in nature and it's not usually in the forefront of communications when it relates to healthcare. There has to be a private family perspective, a grassroots approach for the rare disease community and their advocacy group.
Trying to provide guidelines, posts for families, especially the ones coming behind you, to leverage the experiences that you've got, best practices.
When you're given the opportunity to participate in any activity within Washington, D.C., to your point, you are at the pinnacle of the ears and the eyes of a legislative process.
They're there to listen, and it's an opportunity to educate them. At the end, you can always ask them to join the Rare Disease Caucus. It's a good opportunity to have a conversation and bring attention to issues that are important to the community.
What we try to do when we're here is to share with them the progress that's being made, but also the need is continuous, putting in a framework that you can follow up subsequent to this week.
This is not a Republican or Democrat issue. It's an American issue. We can't wait. And we can't wait till next year. We need to do it now.
We're about to go into Senator Carper's office and speak to them about Rare Disease Week, more specifically Rare Disease Day and Cystinosis that affects us. Hoping to invite him to join the Rare Disease Caucus. Hopefully get him to support the Open Act.
I am about to walk in to do a greeting with Senator Tim Scott from South Carolina. We're going to focus on the Open Act as well as other legislation in the Senate, to which the Senate has not necessarily moved as actively as the House has recently on the 21st Century Cures Act.
I am here to meet the representative, Joseph Kennedy, and I am going to ask him to be a part of the Rare Disease Caucus.
Whether it be the FDA, the NIH, we can do better. And streamlining the process, allowing our researchers to work together, particularly on the trials, but be able to get those devices earlier and quicker is really something meaningful.
Some of the issues that I'm running into right now are with work and medical together. Being an adult, I need to be able to take care of myself, and at this point I can't with the insurance that I have living with now.
Some people don't understand when we say that we do have these pains or we have to miss work or school.
There needs to be some policy changes that happen. There needs to be more access to care, more access to drugs.
I have to take medication every single day in order to stay alive. I'm lucky where I get coverage, but there are many cystinosis patients who don't get the coverage they need.
My wife and I, Evelina and I, made a commitment to support the organization as we transitioned from the initial diagnosis and became stronger advocates for our son, as well as for the community, being in the position to advocate and to not only feed ourselves, but take on the responsibilities of feeding others.
When Sarah was diagnosed, my wife Katie and I knew that we would always continue to give everything we had as parents for our children.
Well, we just came out of Senator Carper's office, spoke with his representative about joining the caucus, about supporting the Open Act. We also mentioned some more localized things that we feel are needed in Lower Delaware, Sussex County, where we come from.
I met with Mark Cocaine today, a representative from Wisconsin. We spoke to him about getting the Rare Disease Fund Act passed to help out with funding for medications and devices and everything else that rare disease patients need. During the whole meeting, I was very, very nervous, but then once I got done speaking, I felt very comfortable. He said he was trying to do his best to get the act passed.
Meeting with Joseph Kennedy went great. He seemed really intrigued. He took my USB on the information of the Cystinosis network, and we got him actually to say yes about joining on to the caucus.
Better treatments, improving the quality of lives of individuals, or giving some people just new hope to move forward in the representation of individuals that have specific rare diseases and disorders.
In the end, what do you want for your kid? You want to ensure that they are given every opportunity to, quote unquote, mainstream and to become productive contributors to our society.